Let's go ahead and get started. Just want to touch on this screen very quickly and just talk about the patient experience platform as a whole. I mean, a lot of people think of PXP as just portal, but there's other avenues for patient experience platform for patients to reach out to you from a digital perspective. So we have that visit management here, which is really where we think about patients managing their appointments, doing their scheduling of their appointments. So we do allow a patient self-scheduling tool, and I'll show you that. Coming with that, with visit management, our PXP program has the ability to send reminders and notifications to patients of, it's time for your appointment, those kind of things. We have in beta testing today a new solution called Patient Engage. It was kind of rebranded. It was what we called Patient Pre-Check, but patient will get an appointment reminder. They'll be able to click on that reminder, accept the appointment or confirm the appointment, and then they can go through and answer some questions, update their demographic information, update their payer information. If there's a copay or a balance, we can notify them of that. And then even fill out forms before they come in. So that's not something I'm going to show you today, but it's something that is in the works. And then along with the pre-visit, really in post-visit, we have the ability to do patients to pay their bills, either through a guest pay option or through NextGen Pay powered through InstaMed through the portal. And then we also have instant medical history. This is a third-party tool that we partner with strategically for capturing encounter-based discrete data that goes right into the NextGen templates. And then we have some forms that come attached to NextGen portal as well. Another part of the patient experience platform is our virtual visit solution. And we've just recently added remote patient monitoring. So remote patient monitoring allows you to have programs set up for blood pressure monitoring or glucose or any type of device they have in the home that's Bluetooth enabled to their phone. Then that data can be sent over into a dashboard for you. It's someone at the practice to review and send to the EHR. And then obviously in-office visits. And then post-visit, again, paying your bills, making sure, the patient's getting their balance and that information. And then we partner with a solution called Clinet for reputation management. It's so where you can send out questionnaires before the patient even gets to their car. When they leave your office, they can get a text that says, hey, can you rate your visit, or did you have issues? We can do patient reported outcomes. We can send patients questions about their surgical event or anything like that. So that, again, is a third party here through reputation management. And then obviously portal really is kind of the hub of patient experience, but just wanted you to cover all that in the portal. We'll look at prescription renewals, messaging, health records, provider patient messaging, payments, and chat. And I see a question. Let's see. Can we send payment receipts through the portal if we forget while they are in the office? If it is saved in the chart somewhere, you have the ability to right-click and send it to the patient. You can send documents to the patient. I'm not sure about receipts from PM. I'll have to check on that, Lisa, but that is a great question, but I'll see if I can follow up on that for you. Okay. I want to highlight some of the new functionality that has come forward with the new portal. If you're moving towards 6.21 or Spring 21 release, as we finally refer to it, you'll get a review of all this, but I just thought I would highlight this. If you're already on Spring 21, you should have this, but I thought I would review this real quickly. We now have the ability with the new portal to do automatic enrollments. No more tokens, and I'll show you that workflow. We support multi-practice where the patient can drop down and pick what practice they want to communicate with through the portal or get information on. And that would just be one single login, so that's really good. We're automating and sending information to the portal from the chart. The CCDA will go out when the portal account is established. When an encounter is completed, patient can request it and we'll automate it back to them, or you can manually push it. So several ways, but we really want to automate that process for you as much as possible. And then we also have some tools now to help you management for trusted representatives or care managers or guardians of children, parents, and guardians, and or maybe I'm an adult child monitoring my adult mother's account or parent account. So there's different ways you can set up management of that. There's some new icons within the EHR and PM that will highlight and let everyone see across both areas of workflow if the patient is enrolled in portal. And then we have some new electronic forms. And then there's a new patient experience configuration tool that sits outside of file maintenance. Some of the stuff is still done in file maintenance, but there's also a config tool outside of file maintenance. I've got a couple of screenshots here. I'm going to get into a demo in a moment, but I just wanted to show you a couple of screenshots of how that automated enrollment process happens. And that really happens with, really, you have to have 6 demographic fields completed or required. And I like to think of that as a shell of a demographic record. You can see last name, first name, date of birth, birth sex, email, and zip code. Once those 6 fields are entered, the patient gets an email that says, hey, welcome to blah, blah, blah practice, or whatever your practice name is, NextGen Healthcare. Please click below to create your account. And so they click that, they answer one security question, they create a username and password, and they're in the portal. So no more tokens. It's a very streamlined process both for the practice and the patient. Now, here's what the icons will look like. This one indicates that the patient has not enrolled, and this one is an indication that the patient enrollment is pending, meaning the invite has been sent, but the patient has not accepted it. When the patient gets the invite, this is what it looks like, this bottom screen right here. It's just a, hey, John, from Citywide Practice. Here's your, please click here and create your username and password. And they would click sign up here, and they would go through the process to sign up and enroll in their portal. I do have a question out here, so let me pause and see, Matt. If you're using NextGen Pay, so Wendy asked a question, another Wendy asked a question, which credit card vendor will be processing payments? If that depends on what you use, but if you use NextGen Pay powered by Instamed, yes, it would be Instamed. So if you're already using Instamed, we'll just be able to work through you with Portal to be able to allow those payments to be sent over through Portal as well. Okay, I'm going to switch screens here for just a moment, and I'm going to go over into my Portal. So I'm going to sign in as Donna Jones and log into her Portal account real quickly. While that's going through, we've had a little sluggish, so we did some updates on the system. It might take a minute. Here it goes. Looks like it's going to paint for us. There we go. But I will show you. Let me sign out. I wanted to point out, here's that guest pay. This is where you can pay your bill without being a Portal patient. So you could put that link that I just clicked on, you could actually put that link on your practice website. So the patient could actually pay their bill even if they're not a Portal patient. So I'm going to go ahead into Donna's account and just show you a couple things in here. And I'll touch on a couple of other PXP solutions toward the end if we have time. So the new portal, again, a much streamlined process to get the patient logged in and to get them here. I look at this and I think very easy icons to understand, really not a lot of education needed. If I need to ask you a question, I want to schedule an appointment, it's pretty self-explanatory. We do have a chat feature here where you can click on, put in your email address. They verify you is the right email address, and someone at NextGen will chat with the patient and help them. We're never going to talk to them at all about any of their, any of their health information. We are only going to help them navigate the portal, like how do I reset my password, or where do I find my health record, or just questions like that. So this is a feature you can have as a part of PXP. So pretty easy here. Here's where the patient would receive and send messages. They can ask questions. You can categorize that questions, configure them at the practice based on how you want questions to be routed. So we'll use some routing rules in the background to route nursing questions to nurses, billing questions to billers, scheduling questions to schedulers, and so on and so forth. a very quick and easy process to send a message. You can just say, I have a rash and I see Dr. Barclay. What should I do? And then if the patient wants to take a picture of that rash and send it over to you, we now support the ability for the patient to send up to 5 images at one time. So they can submit that over. So a very easy way. And again, these messages are handled through message routing rules that you will set up. And it will probably be through work groups and task groups that you already have at your practice. So you're not a lot of additional uplift for you to get this ready to go. Patient self-scheduling, this is where the practice can turn on, if they choose to, provide this service to patients to allow patients to schedule their own appointments. This is real time. It does hit the scheduling book in PM. Patient self-scheduling sits on top of practice management. It honors all the rules you have in practice management, plus gives you additional rules engine that you can set up as well. So you can decide what appointment types, what event types, what providers you want to allow patient self-scheduling for, what locations if you're a multi-location facility, and even times of the day and how many appointments through self-scheduling. I'll start with my provider right here, but just to also point out, you can see my upcoming appointment here on May 16th, and you can see my past appointments. So I'll start here with provider. It's showing me the last provider I saw at the practice was Dr. Barclay right here. And I like Dr. Barclay. I want to see him. You can restrict patients to only seeing providers that they are attached to in the practice as well. I want an office visit with him, and you can decide what event types, well visits, office visits, sick visits, virtual visits. You control all of that. Very detailed rules engine behind the scenes. I like to go to the main office because it's close to my home. I'll take that 27th visit. I'm going to choose that 4:15 time. And I'm going to skip the insurance. You can require this. I don't have mine set up as required. It's not bolded. So I'm going to skip that for now. And then I'm going to say everything is correct. And then my appointment is set. And if I go back, I'll see that new appointment that I just created on the 27th. And here it is. And that now is on the practice management appointment book. Again, very detailed, very rules engine driven. So you're not totally up your entire appointment book. Some people start small with just well visits and then maybe want to branch out to other type of visits if you wanted to do that. So that's patient self-scheduling. And I know I'm rushing through this. There's just a lot of information to cover here. We also support the ability to do med refill. So here are my 3 meds for Mrs. Jones. I click on that refill request. I'm usually at the main office. There's my Dr. Barclay. It's going to bring in my default pharmacy. I'll choose that. I'll continue. And then I'm just going to say I need my metformin refilled. And then I can just confirm that. And it's going to be sent over. Again, medication refills are routed to the inbox in NextGen, in the EHR. They go to a different inbox than other messages because we don't want to confuse med refills with regular messages. So those can be routed and given permission as who has the ability to manage medication refills. Here's where I can pay my bill just as I could through the guest pay. I can pay it through here. The merchant processor or vendor would be Instamed if you go with NextGen Pay, or if you have another merchant processor, then we would put a link outside of Portal to work with. But we partner with Instamed, but we can partner with other vendors. But Instamed is our strategic partner. I would just put in how much I want to pay. All of my information came over because I'm logged in as Miss Jones. It knows who I am. I have a credit card on file. I could add a new card if I wanted to. But if I know my security code, I could enter that and then submit my payment over as well. And then let's go back over to the screen and see, let's cover a little bit about health forms. So we do provide you with a general registration and health form that comes out of the box already created. This is a very comprehensive form. I'm just going to open one up she's already filled out. It covers everything from your demographic information, your address, your meds, your problems, your family history, your payer, so you can see all this information. So this form is filled out by the patient, and then it goes to the chart, to a PDF, to an encounter, and then it's saved as a PDF, but then also that PDF can be absorbed, that data can be absorbed and sent to discrete fields within NextGen as well. And then we support some other forms here, the consent form. So if you want to allow patients to do their consents, I'm just going to put here Donna Jones. I'm not a very good driver here on my mouse, but if I were doing this on my phone or my tablet, I could sign it with a stylus or a pen, then I could submit that over as well. So those are some of the forms. We additionally support the integration with instant medical history. I may have an IMH form out here I can show you. Let me get back to her messages. Let's see if I have here's an IMH form. So yes, so you can come in here and patient can fill out their PHQ-9, their history of present illness for their cough. Instant medical history has hundreds and hundreds of forms that the patient can answer before they come in. They can fill out and answer, and those will be sent over to discrete templates within NextGen as well. And then the last section to just cover here on the portal would be just my ability as a patient to view my chart. I can come in here and I can view a summary of my chart. I can see all of my meds. I can see my problems, my procedures. I can see all of my results, all of my encounters, and you can see Miss Jones has been quite a sick patient. I use her a lot in demos. I need to clean her up a little bit. And then I can see all of my social history, medications that have been administered to her at the practice, instructions we've given her, assessments we've done. All of this is going to come over in a discrete format in this CCDA. And then if you choose to send her other documents from the chart, so maybe you sent her some education, like information on her diabetes, better managing that, or if she was a part of a remote patient monitoring program and you sent her blood pressure readings, she could see all that. She could download that information as well. The patient does have the ability to request a health record right here. So I would click on this. I would choose the date, or I want a comprehensive one. They can do that. It will, the system will automate it back to them. So no workflow or no uplift for anybody on the practice side. So the patient may be going to Florida for the summer, for the winter, if it's a cold winter and they don't want to deal with snow, if they're up in the Northeast or whatever, they can choose a date. They can, when they receive that, they could share it with another provider, or they could download it and have a copy on their PC or wherever they're going to travel, whatever they're going to travel with, or they could print it out. So that's a high-level overview of Portal. A couple of other things within our PXP platform is our remote patient monitoring platform. I'll just kind of give you a quick overview of how this works. So remote patient monitoring sits on the same platform as your virtual visits. If you use our virtual visits, you've got your upcoming visits, your completed visit, and then you would have a remote patient monitoring dashboard. And so this is powered through Validic. They're our middle software provider that handles the data coming from the device, and the device to the phone, and then the phone into this dashboard. So if I want to see a patient, I can come here. If I want to look through my hypertension program and I want to look at Donna Jones's blood pressure, I can do that. I can see she's not taking her blood pressure on a regular basis. I can see the recent readings that she had. I'm looking at it in a logbook format. I can look at it in a chart format. And if I want to, I can upload that data to the EHR. So the patient, essentially, you enroll a patient here through the program, you put all their information, and then the patient, let me get my phone pulled up here. Let's see if I can share my phone with you guys. It's not, let's see, hang on a second. Sometimes it takes just a minute to mirror my phone to the desktop. Doesn't look like it's going to let me. All right. Well, I was going to show you the app, but anyway, so the app on your phone that the patient they sign up for, they sync their device, their blood pressure device, and their phone, and the readings come into the phone, and then from here it's sent to this dashboard for everyone to be able to view, and then typically somebody at the practice would manage this for you to be able to keep up with who is in the program and how do you want to be able to do that. So that's part of the patient experience platform that we talked about at the beginning. Let me see if there's any more questions. We talked about Instamed being our vendor for credit card processing. Yes, that would be Instamed. Can messages from patients be answered by the provider via NextGen Mobile? Not today. We're not doing messaging through mobile at this time. That is, I believe, something that is being looked at and possibly on the roadmap. I don't know. I don't have a date or an answer for when, but that's not the first time I've heard that question, so thank you for bringing it up. Are the forms sent to the patient to be filled out before their visit, or does the patient have to go in and choose and fill out the forms? Well, that's a good question. So if I go back over to portal, just to reiterate what she's asking there, let me open the portal back up real quick. So the general registration and health history form is always going to be parked inside the portal. So when I log into portal, that form is always going to be there. Obviously, you want to alert new patients to filling it out. And when a patient enrolls in the portal, creates their account, they get a large message here at the top that says, please go to the health form and fill out your general registration health form. So that form is always going to be parked here. And at any time, the patient can go back in and add any updates to it. So if their address changes, their payers change, jobs changes, whatever's different, they have something new to add to their health history, they can come in here at any point in time and update this. You might want to send them a message before their their yearly visit, and say, please go in and update any information that we might need to know that's new to your health record or whatever. So these forms are always going to sit here. Consents that you customize or configure will be here, and then you can create other forms that you want to be able to have the patient have access to. Now, other forms, if we go to messages like IMH forms, you would push them to the patient. The patient would get an email that would say, hey, you have a new message, and they would come in and they would see that they need to complete their PHQ-9. And as I told you earlier, we're working through this new solution called Patient Engage. Patient Engage will be able to attach IMH forms, so they can look at the event type and say, oh, they're coming in for a well woman visit, I need to send XYZ form to them. So we have the ability to send those forms as well. So it's kind of a twofold answer to that question. Some forms will always be on the portal. Some you can manually push, and some you can automate through Patient Engage. I hope that answers your question. All right, let's see. What other medical history forms are available? When you say it's in NextGen discreetly, is it in the template or does it store in a PDF? So IMH forms are discrete data. So like if I send the patient a PHQ-9 and I answer all that, when that patient arrives and checks in for their visit, the system will send that data directly over into a PHQ-9 template. So the IMH forms can be mapped to your NextGen templates. We have tons of them already mapped. We have customers already using that. They still come over as a PDF, but they also will come in as discrete fields. The general registration and the health history form comes over as a PDF. That data can be brought in and it has to be reviewed, and then it can be sent discreetly to the patient's record as well, like medicine, meds, allergies, problems, past medical history, social history. That can all go to the discrete fields as well. When the forms are in NextGen discreetly, is it in the template? It's in both places. It can go to the template and it can be a PDF stored in the chart as well. So you have that PDF copy, but you also can send it over directly to the templates. All right, let's see. Yes, the chat feature, someone asked, could you turn the chat feature off? Yes, that actually is an additional item that you would add to Portal. So if you don't want to purchase that piece, it's kind of you pay as you use it. You don't have to turn it on. So that is optional. Good question there. Thank you. can we set scan documents to send to the patient portal only signed off by the MD in their PAQ? I'm not sure I understand this question. I think it says set. I think you meant, can we send scan documents? Can we set scan documents to send to the patient portal only upon scan documents? I'm not sure if scan documents will go to the portal. I'll have to check on that one. Right now, results do have to be signed off before they are sent from the PAQ. But if it's a scanned document, I'm not sure about that. I'll have to check on that one for you. Can we send? Okay, yes. Let me reread that. Can we send scanned documents to the portal only upon sign off by their MD? I believe you can if it's a result. I'll have to double check on that as well. Have they added later hours for the patient chat? We are on the West Coast and patient stops at 5 p.m. I don't know that they've changed that yet, but I believe they are looking at that. So yes, that is a great question. Thank you for bringing that up. Yes, it is 8 a.m. to 8 p.m. Eastern Standard Time. So you're wanting to know if it would extend further into the 5 p.m. hour for you on the West Coast. Yeah, you can do sign off with actions. So you do have the sign off with actions. So let me go. I know we're running over a little bit of time, but I just want to make sure we spend all the time we need here. In the EHR, let me go over to the EHR real quick. In the inbox, when you move to this new portal, your workflow really is not going to change. So you still have the sign off with actions. So if I go to my portal tab and I pull up a message here, you can see I've still got the ability to compose and do all the same things. But if I'm in my PAQ and I want to look at that result here, I've got the sign off and the sign off with actions. So you could, do different things here. So yes, that is probably the best way to be able to send that document. All right. Really, the question would be if sign off with actions feature works with PXP as it does with NextMD. I'm pretty sure it does. I don't believe we've changed any of that workflow at all. If anything, we've made a little bit of things a little bit better. So if I look at Mary Williams and she has an attachment here, I can actually, open that up, see that attachment, and I could actually add that to the chart as well. So there's some additional features within the portal tab that were not there. I don't really think anything's changed from the PAQ perspective either. And here's an example of a patient whose portal account, she's been sent the message, but she hasn't activated it. If I open up Mrs. Jones' account, who we've been on, you can see she has accepted her portal account. And if I hover, you'll see she last logged in at 12:10, which was today when I was doing the demo. So you can actually see. And then from the appointment book, you have the ability, obviously, to see that. Let me get back to the appointment book. You can right click on a patient's name and come down here to the portal section and say enrollment. You can see enrollment was pending. If enrollment did not exist, let's see, I don't think this patient has a portal enrollment. I could enroll them from the appointment book by clicking here, and then it would ask me to add an email address. So there's a couple of nicer ways instead of having to go to that older way to get the token and things to get that patient enrolled. Beside images, can patient upload and send other documents? Yes, they can. They can send any type of file. It's not really just an image. I just use the image as an example, but it could be a PDF. It could be a Word document. Yes, you can be. You can send those as well. All right. Not seeing any other questions in the chat. Thank you all so much for your time. I hope this has been helpful. If you have questions about PXP, portal, remote patient monitoring, virtual visits, NextGen Pay powered by Instamed, any of those features that you may not be using and want to use or want to explore, please reach out to your account team. They'll be happy to put you in touch with someone from my team or, for a demo and have a further discussion for this. So I thank you for your time. And again, this recording will be posted out on Success Community probably first of next week, if not by Friday of this week. So everyone have a great afternoon. Thank you very much.